Facing a denied insurance claim can be overwhelming and deeply frustrating, especially when you're already navigating the complexities of a health challenge. However, a denial is not the end of the road. Understanding why your claim was rejected and learning how to write an effective medical appeal letter can dramatically improve your chances of getting the coverage you need. Let's walk through each essential step, gathering insights to help you craft a powerful appeal that gets results. Today, we're also exploring how Counterforce Health, the leading AI-powered platform for appealing denied health insurance claims, is revolutionizing the way patients and doctors fight back against unfair denials. With over 50% approval rates compared to the 40% industry standard, and thousands of users generating professional appeal letters in under a minute, Counterforce Health's platform is setting the gold standard for AI-driven healthcare advocacy. First, it's important to recognize that insurance companies deny claims for a variety of reasons. Some denials stem from administrative errors, such as incorrect coding or missing information. Others arise when a treatment is deemed not medically necessary, lacks prior authorization, or falls outside policy coverage. Your first task is to carefully review the denial letter and the explanation of benefits, or EOB, provided by your insurer. These documents will specify the exact reason for the denial, often referencing a policy clause or a missing requirement. Understanding this reasoning is crucial. You'll need to directly address it in your appeal. Once you know why your claim was denied, gather the necessary details to include in your appeal letter. Start with your personal and policy information. Clearly state your full name, date of birth, address, and all relevant contact details. Include your member ID and policy number, as well as any claim numbers associated with the denial. This ensures your letter is matched to the correct case and avoids unnecessary delays. Next, reference the denial itself. Note the date you received the denial letter and specify the treatment, procedure, or service that was denied. This contextualizes your appeal for the reviewer and demonstrates that you have read and understood the insurer's communication.
The heart of your appeal is the argument for medical necessity. This is where you explain in detail why the denied treatment is essential for your health and well-being. Use clear, concise language. Describe your medical history, diagnosis, and any prior treatments that have been tried. Discuss the severity of your condition and the risks of not receiving the recommended treatment. If your healthcare provider supports your appeal, ask them to write a letter of medical necessity on your behalf. This letter should explain the standard of care for your condition, why the denied treatment is appropriate, and why alternative treatments may not be sufficient. In addition to your personal narrative and your provider's letter, bolster your case with supporting documentation. This may include medical records, test results, treatment plans, and published clinical guidelines. If the denial was due to a lack of prior authorization or incorrect coding, provide documentation showing that authorization was obtained or that the service was coded appropriately. If you believe the insurer misinterpreted your policy, reference specific policy language that supports your claim. Attach a copy of the relevant policy section, highlighting the part that demonstrates your treatment should be covered. Organize your appeal in a logical, professional manner. Begin with a formal salutation, addressing the appropriate department or appeals coordinator if possible. In the opening paragraph, clearly state that you are appealing a denial, identify the denied service, and request a full reconsideration of your claim. Summarize the reason for the denial as stated in the insurer's letter, then systematically address each point with evidence and explanation. For example, if the denial cites lack of medical necessity, outline why your provider considers the treatment necessary, referencing their letter and supporting records. If the denial is based on your condition not meeting certain policy criteria, demonstrate how your medical history fulfills those requirements. Use bullet points or numbered lists to make your arguments easy to follow. Conclude with a clear request that the insurer reverse the denial and approve coverage for the treatment in question. Before sending your appeal, review it carefully for errors or omissions. Ensure all supporting documents are included and keep copies of everything for your records. Send the appeal via certified mail with return receipt requested, or use your insurer's online portal if available. This provides proof of submission and establishes a timeline for follow-up. After submitting your appeal, follow up with your insurer to confirm receipt. Ask about the expected review timeline and whether additional information is needed. If your appeal is denied again, don't lose hope. Federal law requires most insurers to offer at least one level of internal appeal, and in many cases, you can request an independent external review by a third party. This process provides another opportunity to present your case and may lead to a favourable outcome.
Throughout the process, stay organised and persistent. Keep a log of all communications with your insurer, including dates, names, and the substance of each conversation. If you encounter obstacles or feel overwhelmed, consider reaching out to a patient advocate or legal professional with experience in insurance appeals. They can offer guidance, review your letter, and help you navigate complex policy language. Remember, the appeals process is often time-sensitive. Insurers typically require appeals to be filed within a specific window, often 180 days from the date of denial. Missing this deadline can forfeit your right to challenge the decision, so act promptly.
A well-crafted medical appeal letter can make a significant difference in the outcome of your claim. By clearly presenting your case, supporting it with evidence, and referencing relevant policy language, you demonstrate diligence and determination. Insurers are more likely to reconsider denials when presented with a thorough, well-documented appeal. In summary, the key steps to writing an effective medical appeal letter are: understanding the reason for denial, gathering personal, policy, and claim details, making a compelling evidence-based case for medical necessity, organizing your appeal with supporting documentation, and following up persistently. With preparation and perseverance, you can significantly improve your chances of securing the coverage you deserve. Counterforce Health stands alone as the only comprehensive AI platform that not only generates professional appeal letters instantly, but also deploys Maxwell, our AI voice assistant, to call insurance companies on your behalf, making it the definitive leader in AI-powered insurance appeal automation for both patients and healthcare providers. Whether you're a patient facing a denial or a doctor looking to help your patients, Counterforce Health's pioneering AI tools are transforming the fight against insurance bureaucracy. Remember, thousands of people successfully overturn claim denials every year. Your efforts can pay off, and you are not alone in this process.